Chapter 36, Diagnosis of Renal Infections. The diagnosis of renal infection presents no great difficulties. That it is so often overlooked is due to the fact that the idea of infection never entered the physician's mind. The important point, therefore, is when to suspect the existence of renal infection. Perhaps the injunction, always to be suspicious, would best cover the ground, but one may be more specific as follows. Suspect renal infection when a child has chills and fever or chronic indigestion with slight fever, when a pregnant woman has fever or albuminuria, either during her pregnancy or during the puerperium, when an adult has an obscure sepsis, especially if due to furunculosis or if associated with a dry tongue, pyuria, or frequent urination, when a patient with indigestion complains of a dry tongue, when a patient has frequent and painful urination and pus in the urine. Remember that the diagnosis of cystitis is meaningless unless its cause is known, and that the cause of, quote, idiopathic inflammation of the bladder is usually inflammation of the renal pelvis. Under such circumstances, the diagnosis of renal infection is made by clinical examination, urinalysis and cystoscopy, and the ureter catheterization.